Hi everyone, welcome to week 4 of your Pharmacology 2 course. This week we are covering chapter 17, which is on dermatologic drugs. Dermatologic drugs are those drugs that are used to treat skin conditions. And because of the nature of a skin condition, because it's obviously superficial to your body, they respond very well to topical drugs. A lot of these can be found over the counter, but there are prescription drugs as well. Sometimes a dermatologic condition becomes widespread, and then we might have to use some sort of oral medication that acts systemically, which means throughout your whole body. But for the most part, the drugs that you're going to learn about in this chapter are going to be topical. So some of the things that we're going to be looking at, some of the conditions, the very first one is acne, and it's acne vulgaris. And there's actually two types of acne that are discussed in this chapter. You have acne vulgaris and acne rosacea, and the difference is whether or not it's the group of people that it affects. So this type of acne is the one that's commonly seen during adolescence. Sometimes you'll see folks that will be like, oh my gosh, I'm 30, 40, 50 years old. Why am I still dealing with acne? And that's because it's a different type of acne. So when we start talking about acne in older people, what we're talking about is acne rosacea. So they're going to talk a little bit about some of the drugs used with adolescents. There's one particular that I want to point out to you because you'll see that there's actually a little story about it because of some of the side effects, and that is the drug called Accutane. Accutane is, it is a very effective drug, but there are a lot of side effects to it. So that's why it's only used to treat very severe cases. Because Accutane leads to depression and suicide in some patients, that's why it has this FDA drug alert. So there is a story about that in this week's reading. So make sure you take a look at that and understand the reason why Accutane is not widely used. And then, like I said, acne rosacea is the other type of acne, and that is acne that is, for the adult form. So again, it's different, because of that, it is going to be treated a little bit differently as well. Some of the other skin treatment or skin diseases that you're going to be looking at this week are psoriasis. It is an autoimmune disorder, so it's very resistant to treatment. Again, topical things are typically used, so we are going to try to treat it topically, but there are some orals as well. So an oral vitamin A type of drug is used to help with psoriasis. For some patients, that is effective. Another disease that is commonly found, I don't know if you'd even consider it really a disease, a condition, let's call it that. Another condition commonly found on the skin is just simple inflammation and itching. And that can come from a lot of different things. What we consider contact dermatitis, this is an example of this might be, using a soap that you're allergic to. That's a good example of contact dermatitis. And then, of course, things like poison ivy and insect bites. So there's a lot of different things used for that topically. Probably one of the more common things is hydrocortisone cream. So it comes in an over-the-counter strength, and it comes in a prescription strength. So the 1% over-the-counter is common. You can find that pretty much anywhere. So that is something that's used for topical things like that quite frequently. Other than inflammation and itching, you're also going to see the condition called alopecia. Alopecia has to do with hair loss. And so depending on its cause and its onset, different things are used to treat it. So again, we're not necessarily going to always use topical, but there are some orals as well for this particular condition. So this is an example of an oral medication that works systemically. It's going to go through the blood to the hair follicles, and it's going to help in that way. A few other things that you're going to see in this chapter is wrinkles, because obviously that is on the skin, even though it's not necessarily a disease. People definitely want to treat wrinkles and to get rid of them as much as possible. Botox is a good example of something that's used for that. Then you're going to look at both bacterial and viral types of skin infections and how do we deal with those, as well as fungal infections. And those are more commonly on things like your feet or jock itch, the areas where it's warm and moist. That's where you're going to see fungal infections. And so they're going to look at things used to treat that. Here's something used for fungal infections of like ringworm, jock itch, athlete's foot, Lotrimens, and again, it's an over-the-counter product that you can find. So a lot of different things that are used for the skin. So as you go through this week's material, if you have any problems or questions, please make sure that you reach out to me and have a great week.